Danielle, and I'm going to be your nurse today. Can you tell me your name and date of birth?
Elizabeth Burt, age 1697.
Okay, do you know where you're at today?
Lincoln University Health Assessment Lab.
Do you know what today's date is?
4/20/2018.
Good. And who is the president?
Rob.
Good. All right, so she's oriented times 3. I'm just going to do a physical assessment and just kind of get a baseline and see. Is that okay with you?
Mm-hmm.
Okay, good. Can you tell me your height?
5'2".
5'2". How much do you weigh?
135.
Awesome. So I'm just going to start. I'm going to take your vital signs. So I'm going to take your pulse first. And you just relax. Okay, your pulse was 64. I'm going to take your blood pressure. Have you been, on a scale of 0 to 10, how much pain are you in right now? 0? Okay, can you sit up for me? Put your feet on the ground. There you go.
You want to smile? That's okay.
I had 110/84. Your respirations were 16, which is good. Okay, so I'm just going to take a look at your skin. So can I see your nails for me? Her skin looks good. Her hands and nails look good. I'm going to check your cap refill. It's less than 3 seconds. She's nice and hydrated. Her temperature of her hands are they're warm and equal. She doesn't look like she has any rashes or dry patches. So the moisture is nice and moist. She doesn't look like she has any dry skin. Texture is good, no rashes. Check all the way. Good. Okay, so I'm going to start off after that by looking at your head and kind of your face. So I'm just going to palpate around your head. I'm going to checking her hair, her cranium, making sure I don't feel any lumps or indentations. Is there any pain with that? No? Okay, I didn't feel any abnormalities. Her hair, she has good hygiene, good personal hygiene. And I'm going to feel your temporal arteries. Those are bilaterally equal in strength. I'm going to feel your temporal mandibular, and I want you to, can you open your mouth and close? There is a clicking, but does that hurt when you open that? Okay, good. I didn't feel any crepitus. Okay. So I'm going to look at your maxillary sinuses and let me know if it hurts, okay? No? And frontal? Good. And I want you to smile really big for me. And can you close your eyes and let me open them? Good. Okay, now I'm going to move to your eyes. I'm going to start out by doing, it's just kind of a test. I want you to close your eye, one eye. I'm going to do visual confrontation. I want you to tell me when you can see my fingers. Now, how many fingers am I holding up? One. Two. Good. And switch eyes. Tell me when you can see my hand. Two. Okay. How many fingers am I holding up?
Two.
Okay.
Three.
How many am I holding up?
Two.
Okay.
One.
Good. Okay. Now I'm going to do your visual acuity. I'm going to go 14 inches away from your face. And covering up one eye, I want you to read the smallest line you can.
4, 2, 6, 7, 9.
Okay, and cover your other eye. You can read it backwards for me.
9, 3, 7, 6, 2, 4.
And what about with both eyes?
4, 2, 6, 7, 3,
9. Good. Now we're going to do the cardinal gaze. I just want you to look straight ahead and follow it with your eyes. Good. Okay, I'm looking at her external eyes. Everything looks symmetrical. I don't see any drainage or redness. Her sclera looks white. I'm going to pull down. Your conjunctiva looks nice and pink. Doesn't look irritated. You haven't had any problems with your eyes, have you? Good. Okay, so I'm going to look at your pupils now. You're going to see a bright light in your eyes. And her pupils are equally round and reactive to light. I'm going to look at your ears. Just looking right now, I don't see any drainage. They look symmetrical. I'm going to feel around. Have you had any tenderness with your ears? You let me know if this hurts. Nope, no pain? Okay. I'm going to look in your ear, okay? I'm going to look at her eardrum and her canal. And I see earwax, which is normal. I don't see any irritation of the eardrum. And can I have you stand up? I want you to just put one hand in your ear and kind of wiggle it around. And I want you to, I'm going to say 3 things, and I want you to repeat after me. C1, 3. Good. And switch ears. B5. Good. Okay. So now you can sit back down. This is called the Weber test. I just want you to let me know if you hear it in one ear versus the other or both ears, okay? So, both. Good. Okay. I'm going to do it again. I'm going to place it behind your ear. I want you to tell me when you can't hear it.
Okay. Can't hear it. Can't hear it.
Okay.
Can't hear it. Can't hear it.
Good. Okay. So now I'm going to look at your nose. Her nostrils are equal shaped. I don't see any deviated septums or anything. Can you push on one nostril and breathe in? And other one? She seemed to have patent airways. I'm going to look at your mouth area now. Your lips are a little dry, but I don't see any lesions or anything. Can you open up? Look inside your mouth. Her buccal mucosa looks nice and pink and moist. Her tongue looks good. I don't see any lesions on her tongue. Her tonsils are a little swollen, but not bad. Can you smile really big when you see your teeth and gums? Looks like she has really good oral hygiene. And open up one more time. Look at her hard and soft palate, and that looks normal also. Then I'm going to go to your neck. Looking at it, it looks symmetrical. The skin looks good. I don't see any lesions or anything like that. I don't see any pulsations, which would indicate either fluid overload or any hypertension. Can you face this way or turn a little bit? I'm just going to feel your cervical lymph nodes. Making sure I don't feel any swollen lymph nodes. I don't feel any swollen lymph nodes. I'm then going to feel her trachea and make sure it's down the midline. Trachea feels good. Can you swallow for me? And our thyroid gland doesn't seem swollen at all. I'm going to feel your carotid arteries, okay, one at a time. Good. And we're just going to do some range of motion. Can you tuck your chin to your chest and look up to the ceiling? And rotate left to right. Can't talk. And put your ears to your shoulders. Good. Okay, so now that I've looked at your neck, I'm going to go to your back. She would have a gown on, but not for today. I would look at her back, her skin characteristics. She doesn't have any lesions or rashes, any scarring or anything like that. Can you stand up for me? I'm going to do a couple things. I would check for her symmetrical expansion. I want you to take a deep breath for me. And her chest equally expanded. I didn't see one side expanding more than the other. You're going to feel me touch your back, and when you feel me touch you, I want you to say 99, okay? 99, 99, 99, 99. Good. I didn't hear any abnormal things. Now I'm going to just palpate around and tell me if you feel any tenderness. And also feeling for lumps. Nope. Nope. No tenderness? Good. I'm also going to feel down her spinal column for any abnormalities or lumps. Let me know if this at all hurts you, okay? Feeling each spinal column. Good. Okay. I'm going to percuss. So you're just going to feel a little tap on you, okay? In all 7 spots. I'll do that on both sides. And then I would listen. Then again, I wouldn't have a gown on. Can you take a deep breath? And out. Again. One more time. Good. So now I'm going to move to the front side. So looking at her chest, it looks symmetrical. Your color looks good. You don't look cyanotic or anything, as if you weren't getting enough oxygen. Your chest shape, you don't look like you have any concave or barrel-chested. I don't see any lesions or anything like that. I'm just going to palpate. Let me know if you have any pain. Nope. None? Good. Okay, I'm going to percuss, okay? Okay, and while looking at this, her respiratory rate, rhythm, depth, and effort looks all good. She doesn't look like she's labored breathing or having troubles breathing. I'm going to listen. Good. And her breath sound good. You can sit back down. So the next thing I'm going to do is your heart. So I'm just going to put my hands on your chest. I'm listening for heaves, lifts, and thrills. Hopefully I don't. Hold my hand, and I'm going to go to the apex of the heart, either with my fingers or the palm of my hand. And I don't hear any of those. So then I'm going to listen to some points on your heart, okay? Listen to your aortic, pulmonic, tricuspid, and your mitral. Those all sound good. I'm going to have you lay down on your left side. I'm going to listen to your apex of your heart for a full minute. I will listen to it for a full minute, but I'm not going to in this video. Okay? And then I want you to sit back up. And you're going to lean forwards, hunch over, and I'm going to listen to your apex and your left sternal border. Good. So I didn't hear any murmurs, so that's a good thing. Okay, so now I'm going to go to your upper extremities, just some range of motion. Can you raise your arm above your head and raise it back? Good. And can you bring it above your head this way and in front of you? And I want you to act like you're scratching your back up this way. Okay, that way too. You go this way or this way, like you're brushing your hair. Okay, and then I want you to act like you're doing a stop sign. Good. Okay, and the elbows, I want you to flex them and straighten. Act like you're holding soup. And pour it out. Good. Okay, so wrists, you're going to flex, extend, and just turn your wrist inside and outside. Good. Now fingers. Flex, extend, and then you're going to abduct and adduct. Good. So now we're just going to work with your thumbs. So I want you to, that's flexion, extend it out. Good. And now point your thumbs towards me. Good. And bring them back together. Awesome. Now we're going to do just some strength with your elbows. So I want you to, I'm going to push and pull on you, okay? So pull towards you and push. Good. Now can I see your wrists? I want you to push up and down. Spread your fingers out. So let me pull them together. Awesome. And now do grip strength. Nice and strong. Good. So after that, I want you to just lay back down. We're going to go to your stomach. And pick your shirt up. Okay, so looking at her stomach, the contour looks good. She's not round. She's not rounded. Her stomach is flat. The symmetry, it's not raised on one side versus the other. I don't see any pulsations or peristalsis, which is okay. Her skin is good. I don't see any lesions or scars. There's a little scar right here. It would be good to document that. She does have a belly button ring. Probably document that. Her belly button is not protruded. It is nice and flat. I'm going to listen to your vowel sounds, okay? In all four quadrants. My hand's cold?
Yes. I think every nurse has cold hands.
I agree. Her vowel sounds are normal active. They're not hypo or hyper. I'm going to percuss on your stomach. couple different spots. And now I'm going to do light palpations and then a little bit deeper. Let me know if at any time you have any pain. Any pain? Good. Okay, I'm going to go a little bit deeper. You hungry?
Yes.
I did. Good. Okay, so your stomach looks good. I'm going to pull that back down. Can I have you sit up for me? I'm going to check your legs out. Okay, so look at your legs. Make sure your legs look symmetrical. One leg doesn't look longer than the other. Your muscles are equally. It doesn't look like you have any muscle loss in one leg compared to the other. Skin characteristics, I don't see any scarring or anything like that. Your hair loss, I don't see any hair loss, which would indicate peripheral vascular disease. I'm going to feel your pulses, your 3 pulses on your legs, okay? I'm going to first feel her popliteal pulses. Hands are cold, sorry. Those are both equally, and they're bilaterally equal and strong. I'm going to feel your posterior. You can relax. 2 hours. Those are both nice and strong. I'm going to feel your pedal pulses. Hers are hard to find. If I couldn't find them, I would use the Doppler. Those are nice and good too. I'm also going to look at her legs. I'm going to be pushing for edema. I don't see any edema. Also, her temperature is nice and good. Her toes are kind of cold, but she stated she was kind of cold earlier. I want you to raise your toes to your nose. Good, and can you push them down? Got it right that time. And I want you to, I'm going to do a reflex on your foot. Your plantar reflex. Good. You're looking for the toes to curl. Awesome. I want you to stand up. We're going to do some range of motion now. Okay, can you put your leg out? Yep. And back in. Good. And can you forwards and backwards? Awesome. And I want you to, you're going to internal, so you're going to put your foot out, and then external with you. Awesome. Now we're going to do your knees. So you're going to flex it, straighten, internal, and then you can external. Good. Now we're going to do your ankles. Okay. So you can sit back, you can sit down. So I want you to pull your toes to your nose, and then extend like gas pedal, good. And then I want you to, you're going to inversion, so you're going to just roll your ankles out, both of them, and can you roll them in? Awesome. Okay. So after that, I want you, so she doesn't have any, we don't have any toenail polish with us, but I would take her toenail polish off. Check her cap refill. It is prompt, less than 3 seconds. And then I would do, I'm going to start out with not start out, but I'm sorry I didn't put those down. I'm going to do some hot and cold therapy, some light touch, and dull or sharp. Okay, so I want you to close your eyes and I want you to tell me what you feel, okay? Well, I'll show you what this is sharp, this is dull, hot, cold, and then this is light touch. Okay? I'm just going to put it on you. I want you to tell me what you think it is, okay? Sharp or dull? Sharp. Good. Light touch. Awesome. Sharp or dull? Good. Hot or cold? Cold. Sharp or dull? Sharp. Okay. Sharp or dull? Sharp. Okay. Light touch. Okay. Hot or cold? Hot. Good. Sharp or dull? Sharp. Hot or cold? Hot. Light touch. Good. Hot or cold? Cold. Hot or cold? Hot. Good. Can you uncross your legs for me? Light touch. Good. Sharp or dull? Sharp. Okay. Sharp or dull? Sharp. Okay. Sharp or dull? Sharp. Hot or cold? Hot. Sharp or dull? Dull. Sharp or dull? Dull. Light touch. Awesome. Now we're going to do some coordination movements. Can you touch your fingers to this joint right here, all fingers, and then go back? Good. Now I want you to put your finger on your nose. I want you to touch my finger and follow it, and then go back to your nose, okay? Okay, one more. Awesome. Now I want you to stand up. Stand up over here. You can scoot back a little bit. I want you to just walk forward normal. Good, and turn around. I want you to walk tandem, so that's with your toes, heel to toe, all the way back. Good, and I want you to face me. Can you close your eyes for me? We're going to do the Romberg's test. You're going to balance for 30 minutes to a second. 30 minutes. 30 seconds to a minute. Good, nice balance. And can you touch your toes for me? I'm just going to look at your spine. Good. Okay, I don't see any kyphosis or lordosis or scoliosis. Look from the back side. I don't see any scoliosis. So since we started, that was part of the flexion of your spine. I want you to extend back. Good. And can you twist at the hips? Awesome. Or not at the hips, sorry, with your back. And then I just want you to lateral bend here. Awesome. Okay, you can sit back down. I'm going to check some reflexes. I'm going to check it with your arm. This is your bicep reflex. Can you bend your arm for me? Okay. Okay, that was a good reflex. Can you bend your arm for me? Okay. Okay. Now I'm going to do your patellar reflex. Okay. That was a good one. Okay. I'm going to do your Achilles. And this one is with the flat part. That was kind of hard, sorry. I'll do it one more time. Okay. All right. Now I'm going to look at your reflexes. I think we're done. I will report what I've found. Everything looks pretty good to me, but I'm going to still tell you physician if he wants to do a follow-up. We can set that up. Do you have any questions? Nope. Okay, I would lower my height of the bed back down and make sure her call light is there. And that's it. Thank you.